Now that was fun, but that's not the type of cabbage we're talking about. Today we'll be talking about coronary artery bypass graft. We'll be discussing a healthy heart, an unhealthy heart, and the procedure known as Cabg. The healthy heart supplies itself with fresh oxygenated blood through the coronary arteries. This is the right coronary artery, and this is the left coronary artery coming off the ascending aorta. In coronary artery disease, the arteries that supply blood to the heart become clogged with what's called a plaque. Risk factors for developing coronary artery disease include high blood pressure, high cholesterol, diabetes, smoking, and a family history. Once these arteries become too narrow, the heart cannot receive the blood it needs, therefore the oxygen it needs, and the person is at risk for a heart attack. Before we were talking about the plaque that builds up in your coronary arteries. This is called atherosclerosis. This is a picture of a healthy artery, and this image shows an artery with a large atherosclerotic plaque. Coronary artery bypass grafts are good for patients with many narrowings in multiple branches of their coronary arteries. In other words, the blockages are too extensive, and these patients are not eligible for minimally invasive procedures. During Cabg, the chest is open, the sternum is split, and the pericardium is open to expose the heart. Once the heart is exposed, the surgeon cools the heart or uses medication to stop it from beating. The heart is then connected to a heart-lung machine to oxygenate and circulate blood throughout the body. A superficial vein is removed from another part of the patient's body. The great saphenous or internal mammary veins are commonly used. The vein is then attached to the blood vessels above and below the area of blockage in order to redirect blood flow and supply the heart with the oxygen and nutrients it needs. Once the new veins are attached, the heart is restarted, the heart-lung machine is removed, and the patient's pericardium, sternum, and chest wall are sewn up. The surgery can take approximately 4 hours, and blood may be redirected through anywhere from 2 to 5 arteries, otherwise known as double, triple, quadruple, or quintuple bypass. Now you're on the road to recovery. Patients can usually get out of bed the day after surgery and are discharged home after 3 to 7 days. Patients are advised not to lift anything over 10 pounds while recovering, and they're also advised not to drive for at least 4 weeks. To avoid coronary artery disease, eat right, don't smoke, and get your exercise.